Live from the Business Radio X studio inside Renaissance Bank, the bank that specializes in understanding you. It's time for North Fulton Business Radio.
And hello again, everyone. Welcome to another edition of North Fulton Business Radio. I'm John Ray, and folks, we are broadcasting from inside Renaissance Bank in beautiful Alpharetta. And folks, if you're looking for a bank that is actually interested in talking to you live, they don't work with computer-generated voices and all the AI that a lot of banks want to introduce. That's Renaissance Bank. That's what I found in the work that I do with them on behalf of my clients. They like to deliver their services in a personal way. But here's the thing. They're big enough to handle pretty much any need you can throw at them. And that's a magic combination. If you'd like to know more, go to renaissancebank.com, find one of their local offices, and give them a call. I think you'll be glad you did. Renaissance Bank, understanding you, member FDIC. And now I want to welcome Brandy Wilkins. Brandy is with Defining Point Coaching and Consulting. Brandy, welcome.
Thank you for having me. I'm glad to be here.
Delighted to have you. Let's talk about you and how you're serving folks out there.
Absolutely. Like John said, my name is Brandy Wilkins. I am a physical therapist by background, but I've been working in healthcare quality for the last almost decade. And I serve people, I serve professionals and organizations by helping them improve patient safety and clinical outcomes and essentially making things safer for the patient. So
you're a healthcare quality consultant.
Yes.
Right? That's what I see in the show notes. So what does that mean?
So I reach out to healthcare organizations, whether that's hospitals or rehab hospitals or ambulatory surgery centers, and I work with their leaders to improve their processes, prevent medical errors, prevent preventable harm, and to make care safer for the patients and the communities that they serve.
Brandy, I want to get more to that because I know it goes, there's a lot to that. Yeah. But let's talk about your background. You said you started out as a physical therapist. Why did you get interested in healthcare processes and patient outcomes? All healthcare professionals are interested in patient outcomes, but why specifically the processes that go into that?
Yeah, absolutely. So as a physical therapist, I work one-on-one with patients, right? I kneecap to kneecap, as they would say.
I like that.
Helping to physically assist patients with their movement and improve how they do things. What I realized, John, was that as a physical therapist, I could only impact the patient that I was with at the time. And working in healthcare quality, working as a consultant, I can influence every patient that my clients influence. So I have a much bigger impact, a much bigger scope in a consulting role than I did when I was working one-on-one with patients. And that is what is most meaningful to me. Seeing my clients, when the light bulb turns on, when they learn a new process, or they're able to do something different for their patients, or when they get their feedback from their patients on how well something went, I take that to heart because I have helped to influence that.
Yeah, that makes a lot of sense. So let's widen the lens out here and just talk about hospitals and some of the challenges that they have when it comes to ensuring patient safety and making sure they're delivering the outcomes that they hope to deliver.
Absolutely. So healthcare is a highly regulated industry. And with all of that regulation, there's more things to do. Compounded on that is staffing shortages. I'm sure people have already heard about that in the news. That's not something that's new, but it's gotten bigger since COVID. There's a lot of people leaving healthcare. And so a lot of organizations are running into, okay, I have all these things that are required of me. How do I do them with the staffing that I have? And so part of what I do when I help my clients is to help them to narrow their focus so they're not focusing on everything at once and really measuring the outcome that they're looking to achieve and figuring out how we can improve the system instead of putting one more burden on that person who is frontline with the patient, that nurse or that therapist or that physician who is working directly with the patient. And for them, it feels like it's one more thing. So how can we take that off of them and fix the system so that we're not relying on human memory, right? That's how the airlines have gotten to be so good at what they're doing. They have checklists and they have processes and they have hard stops in place to make sure that we're safe when we're in the air. And it's the same thing that we want to do in healthcare.
Yeah. So let's give a real life example, if you would, whether that's in physical therapy or some other aspect of clinical care that goes on in a hospital. Maybe you can talk about what a common problem that occurs, right, because of lack of processes.
So one example is medication administration, right? So you have, let's say, a narcotic that a patient needs for pain, and the nurse is going to give that patient that pain medication. In order to do that, nurse has to verify the order to make sure it's the right medication for the right patient. He or she has to go to get that medication from wherever it's stored in the medication room. They have to make sure that they dispense the right amount of that medication. Then they take that medication to the patient. They scan the medication. They scan the patient to make sure, again, that this patient is getting the right medication, and then they administer it to the patient. In there's a lot of series of steps of things that could go wrong. So if they go to get the medication out of the medication room and the wrong drawer opens and they take the medication out and don't double check that, as an example, then they can inadvertently give the wrong medication to the wrong patient. Or if the medication, and that's why there's another check once it gets to the patient at the bedside, to scan the medication and scan the patient to make sure that patient gets the right medication. So in healthcare, there are a lot of systems, a lot of steps designed to stop the process if it's going the wrong way.
So and this, I assume, is heavily technology based.
It is. A lot of it is, we want it to be, because there is some safety with the right technology.
Right.
And that's just one example is the scanning of the medication. Another example is what healthcare calls predictive analytics. So you enter information into the medical record about their heart rate, the blood pressure, all these things about the patient and how the patient is doing that day or over that series of days. And the computer can spit back out to you, the clinician, the person who's working with the patient, what test to run on the patient, what the risk is for that patient to fall based on all this data that's in there. What's the likely that they'll have an adverse reaction to the specific medication that you're given? There is some huge value in technology, but it doesn't replace the clinical judgment that's required from the professional.
Yeah, and technology is not the magic elixir here, right? As you point out, technology is helpful, but it can only take you so far. And I guess there's the old garbage in, garbage out.
Exactly.
There's healthcare providers misapplying the technology, that kind of thing. But what's the state of affairs with the hospital industry generally when it comes to implementing some of these technological tools that can help them with their processes?
So healthcare can be slow, depending on the organization, to implement processes because they want to make sure that they're evidence-based, that they've seen results from them, from the research, because a lot is at stake. We're talking about people's lives. And a lot of organizations don't want to implement something prematurely. But I think in general, healthcare organizations are moving towards more technology that will help because, again, there's staffing shortages. You need something to support the lack of or the decrease in the number of people that's there. Right. Technology should certainly be a support to the system to really help with some of this.
Folks, we're chatting with Brandy Wilkins. Brandy is the owner, chief consultant for Defining Point Coaching and Consulting. So is technology the sole answer? I'm setting you up for that. So that was a softball, right?
Absolutely. It is not the sole answer. You still need the clinical judgment of the person that's working face to face with that patient because technology can inadvertently introduce bias into the algorithm and spit back out something that is not the best for that particular patient population or that particular demographic. So you definitely need someone who's able to think through that. But you also need people to help. And you need support in improving processes, right? You can't, when you're inside of it, it's like you can't see the forest for the trees, as people say.
Right.
So sometimes you need external support to help you to see what you can't see when you're working with this data or when you're working with this set of patients all the time.
What's the receptivity you find of medical professionals inside a hospital to that outside third-party view? I'm sure it varies, right?
It depends, yes. So if it's a regulatory body, we're coming in to survey you.
Oh.
Then there's the run for the bathroom, right?
Yeah.
Or the run for the hills.
Yep.
But when someone like me comes in to be a part of their team, to really help and I'm not evaluating you from, and I have been in that role before where I've been a surveyor and I worked for an organization where I was the person that the company paid my organization to come into their hospital. But working on a consultation basis like I do now, I'm on their side. I'm here to help them. I'm here to support the work that they do. I'm here to give them more ideas. I'm here to help them actually see the results that they want to see in a non-threatening way, because my report that I leave with them is not going to an external body. It's not going to the public. And so they have an opportunity to improve something in a safe way.
That's a great point. Is that something that they're eventually required to release, or that always stays private?
That always stays private.
That gives people an incentive to really do something, right?
Absolutely.
That's impactful, because there's truth telling, right? And facts are friendly, and when you get the real facts and the truth, you're able to really substantively address problems.
Absolutely. And when people feel comfortable sharing, like you were saying, then we can make bigger progress when they're not afraid of, if I say something, it's going to affect my business and it's going to affect potentially my pay, right? Or it's going to affect my reputation in the community. And people feel safer to have those conversations and to know that someone's on their side.
Yeah, for sure. So you mentioned medication administration. What are some other areas in which better processes come into play as a way to significantly improve patient safety and outcomes?
Yeah, so fall prevention, preventing patient falls, because being in the hospital is just a risk for patients to fall and to injure themselves. Preventing hospital-acquired wounds. So the patient comes in and their skin is perfect, maybe a little fragile, and they leave with a wound, right? So that's a process. Falls, medication errors, everything. I mean, you can have something as simple as, or not as simple, but how do you prevent a hospital-acquired infection? How do you prevent pneumonia, right, when the person is there? How do you prevent someone from getting the flu at the hospital? They came in without the flu, they leave with the flu. And so all of those require processes and steps. Yeah.
Wow, a lot there. So what's at stake here, Brandy, in terms of I guess a couple of things. One is the scope of the problem and how it impacts, however you measure the reputation of the hospital, right? And then the hospital's bottom line. What's the impact of some of these issues there on both reputation and bottom line?
What's at stake is really the patient's life. And when you work with your community and your patients at the grocery store or at the bank or in your neighborhood, that's really what's at stake. And when hospitals take that initiative to improve their processes, patients are going to refer other people to them, right? Because not every patient that comes to the hospital is coming in an emergent fashion. Some are coming for surgery and they choose where they go for care. And then it does affect the data, the outcomes that is publicly reported. Because even though the reports that I do are protected and not reported, the outcomes of that visit are going to be publicly reported. And so if the hospitals, the healthcare systems improve their processes, then they're going to improve what is externally reported.
We're here speaking with Brandy Wilkins. Brandy is the owner and chief consultant of Defining Point Coaching and Consulting. So let's talk about how you work. Hospital contacts you. They want to talk. They want to talk about their issues and how you can help. How does that conversation unfold?
So we talk through what their needs are. So maybe they want to improve their processes and we focus on a process or an outcome at a time. Or maybe they have a survey that's coming up that they want to prepare for. So I'm not the surveyor, but I can do a mock survey for them so that they can be ready. Their teams can be ready. They know how to talk to a surveyor because I've been a surveyor. Mm-hmm. Maybe they want to look at moving into a specialty program, and I can help them walk through that process. So we have a conversation about what it is that they need, what they're looking for, and we come up with a package together that's going to work for them and the length of time that they want to work with someone and what their desired outcome is.
Yeah, that makes a lot of sense. Now, you were at Northside Hospital for a long time.
I was, yes.
Yeah, and talk about that experience, not specifically, but just the frame of reference that gives you when you have that initial conversation with a hospital. Because you've been inside, you've seen what happens behind the curtain, as it were, the perspective that gives you to be able to bring to the engagements that you work on.
Yeah, so I've worked frontline, so I've seen what it is to be the clinician, to work directly with the patients and their families. I've also worked with middle leaders and hospital executives and how to streamline processes across the system to make sure that patients can expect the same level of care regardless of which hospital in the system they go to, which is important, right? If you're building a brand as a hospital system.
Sure.
So being on the inside and being able to see not just from theory how things work, but the reality of the challenges that hospitals face, not just at Northside, but I've worked at academic medical centers and other types of hospitals, rehab hospitals as well. And it's not just working from theory. It is a experiential knowledge, front hand.
Yeah, that I'm sure the folks that you work with appreciate that as well. Where do these changes fit in the panoply of all the concerns that a hospital administrator has, which are myriad, right? We've only got a 30-minute show. We couldn't go through all of them, right?
Right.
Where does it sit? And I guess how do you impress upon those that you speak with the relative importance of getting their processes right and to create the outcomes you're talking about?
Yeah, the more proactive and preventive the hospital system is, the more that it will affect the bottom line, which is what the CFO or the CEO is looking at, right? Mm-hmm. Yes, they want to help patients, but they have to pay people too. Hospital workers don't want to work for free.
Sure.
And they have a business perspective that they have to legitimately be concerned about. Mm-hmm. And taking a proactive versus a reactive, something has happened, there's been an adverse outcome approach, builds trust. It builds referrals. Mm-hmm. And then ultimately it does affect savings for the hospital.
Yeah, it's, as you said it earlier, the life and welfare of the patient is the most important thing. However, if you don't have profit, you don't have the ability to pay your employees, and you don't have capital to reinvest in the business because that's a business that requires continual reinvestment of profit, correct?
Absolutely. We were just talking about technology
Mm-hmm.
earlier.
Yep.
You can't afford this expensive technology if you don't have the capital to do that. You can't afford to give raises to your employees to keep them.
Mm-hmm.
You can't afford to get that specialist physician, right? You can't afford to keep the lights on. Just
Right.
So let's keep the building running, the bricks up, and the lights on.
Yeah.
And there is a business perspective to that even in not-for-profit hospitals, they still have to consider that because there's bills they have to pay.
Mm-hmm. What does a hospital administrator, a healthcare professional, what do they need to know before they get in touch with you? In other words, do they have to have an identified problem that they see, or can you come in and, pardon the pun, diagnose?
Either or.
Yeah.
If they already know that there is a problem and they know these are our top 10 problems, we don't know which to tackle first, then absolutely I can help with them with that. If they say, we just feel like something's wrong, but we can't put our finger on what the true issue is, then I can come in and help them with that.
Brandy, you mentioned that hospitals are they're key clients for you. What other healthcare organizations are good fits for you in your practice?
Right. So when we say hospitals, those are acute care hospitals like your Northsides and your Wellstars and those kind of hospitals, Emory's, rehab hospitals, and ambulatory surgery centers. So if you're a patient and you want to have an outpatient procedure where you're not actually in the hospital, because some people feel, oh, okay, I'm going to go in the hospital, something bad is going to happen. Let me save money and go to an ambulatory surgery center. And they are regulated a little bit differently than the big hospitals. And so I work with those organizations as well. So typically acute care hospitals, rehab hospitals, and ambulatory surgery centers.
And what's your geographic spread on where you're willing to work?
I can work virtually. If they need help with their electronic medical record, they can give me access to that virtually. So there's some things that I can do without being directly on site. But in terms of coming on site, I can do that nationwide. There is I say nationwide, in the United States.
Yeah, there you go. Okay.
I have not branched out internationally.
In the continental United States.
In the continental United States.
Okay.
Now, if someone wants to bring me to Hawaii, I'll be glad to take a trip there.
I'm with you on that. Cool. I would love it if you could share, I'm sure our listeners would love it as well, if you could share a success story, one that helps illustrate the terrific work that you do.
Absolutely. So I worked with one hospital system who was having a high fall rate. So a lot of their patients were falling and some were getting injured. And I worked with this hospital to help reduce their fall rate by about 12% in 6 months, which not only reduced the number of falls, but also reduced the number of patients that were getting injured. And so obviously that's a win for the staff, right? The staff don't want their patients to fall any more than the patients or their families do, but also help to build trust with the patients and their families that their family member or they were going to be safe when they came to this hospital.
Yeah. Wow. Terrific work. Brandy Wilkins, folks, Defining Point Coaching and Consulting. Brandy, this has been terrific. I can't imagine there aren't some folks upon hearing this interview that they wouldn't want to be in touch and learn more about what you have to offer their organization. So let's give them directions.
Yeah, absolutely. I would love to hear from you and see how I can help. You can reach me on my website and sign up for a consultation. That website is definingpointcc.com. So DEFINGPOINTCC.com.
Brandy Wilkins with Defining Point Coaching and Consulting. Brandy, thanks again for coming in. We're delighted we could share your work and honor it and shine a spotlight on it. So keep up the good work.
Thank you for having me.
A pleasure. And folks, just a quick reminder that I have a book out. It's called The Generosity Mindset, A Journey to Business Success by Raising Your Confidence, Your Value, and Your Prices. That book is available on Amazon and coming up in other book establishments as well as we record this show here 1st of December 2023. You'll be able to find it really wherever books are sold. But if you want more information, you can go to thegenerositymindset.com. If you're a professional services provider who needs help with your pricing or business development, this may be a book for you. And I want to thank you, our listener. You have been so generous with us. Speaking of that word, you've been generous with our guests too. What you've done is shared the show when you've heard of guests where you think, hey, I need to connect this person I know and let them know about this particular guest because they can help them in their business. Please continue to do that. If you've heard something here today that makes you think you want to share the show, please do that. And for any of our business leaders, Brandy, we've had some 1,100 guests on this show, and we're here to highlight them, celebrate them, and to aid them in their journey to success. Please help us help them and help us be the voice of business in the North Fulton region. So for my guest, Brandy Wilkins, I'm John Ray. Join us next time here on North Fulton Business Radio.